Hilde Meijs. I work for PUM Netherlands, and PUM is a Dutch organization who has got about 1,800 experts in all kind of fields, all kind of expertises. My own expertise is health and education, and I work in PUM as a healthcare expert, but also as the coordinator for all the questions on healthcare from all over Africa. With PUM, we try to make impact by concentrating on sustainability, on assisting entrepreneurs, and to help like in healthcare, it's mainly about improving so that people can really make their impact and can have better lives for the people. Well, there was this question from the Busoga Health Forum, and I thought it was a very interesting organization, and I wanted to learn more about Uganda. Besides, it was an organization for which I thought there might be multiple questions for PUM. So I decided to go here and find out about the organization itself and to see how PUM and the Busoga Health Forum can work together and maybe partner or maybe even make an ecosystem. And in an ecosystem, that's a term PUM uses. They say if you work in a certain field, you better work with more projects on a certain subject, because everything has to do with everything. And if you, for example, improve farming, then it's better for the food, it's better for the health. If you improve health, it's better for tourism, it's better for... So there are all kinds of relations, and they like to find out where we can really work and improve the situation for the people in a certain area. So I think that's for Busoga a very good opportunity, and for PUM possible to be of any assistance if asked for. Well, with the whole country, I think they call Uganda the Pearl of Africa, and I can imagine that it is the right way of talking about Uganda. It's a beautiful country, very green, and I met a lot of very friendly and hospitable people. And I met them also in the forum, and what I was amazed of was the quality of the programs they are working on, and the methods they use, the way they work on it. It's always on. There's a lot of education in it, and it's always in a two-way traffic. So they want to tell something, but they mainly want to pick up what is important for the people and to start from what is important for the people. They use human-centered design methodology, and I think that's a very strong methodology. It doesn't always go fast, but I think the impact is even more when you use this methodology. And I was really happily amazed that the Busoga Health Forum is using this methodology all over. And they trained a lot of people in using it, so they can again use it in talking with their clients, with their patients. So I think it's very powerful. Well, I've heard a lot about the different projects, and I attended, which was very interesting, a drama show. It aimed on family planning. And well, as you maybe know, there are a lot of people in Uganda who are not very literate, so you have to look for other means to address them. And it was very nice to be there, because suddenly they started somewhere and suddenly there were about 200, 250 people, all very concentrated, listening and standing there. They stayed there. And they were very interested in the drama which was performed and the music they heard from the drums. So that was very nice to hear and to see. And Another thing is, which I thought was also very interesting, is that they have weekly webinars on subjects where professionals from the forum tell something to all kind of people in the forum. You can subscribe to them. I was subscribed to this one, and there were about 260 people who were listening to this webinar, which was a big group, I think, and also there I saw there was a lot of interaction and there was possibility to put questions. So it was, I think it's very powerful the way they work.